Good afternoon, ladies and gentlemen. Welcome to our TICAD9 thematic event titled Co-Creating with Africa to End NTDs, Industry, Academia, Government Collaboration, and the Power of Youth. I'm honored to moderate today's session. My name is Chiharu Shigetomi, and I'm currently engaged in activities aimed at eliminating NTDs as a member of the NTDs Youth Organization. We are honored to have you join us today to discuss concrete ways to address neglected tropical diseases, or NTDs, through collective action, innovation, and solidarity. To open this event, we are privileged to welcome a strong champion for global health and NTDs. Please welcome the Honorable Dr. Ayano Kunimitsu, member of the House of Representatives of Japan and Secretary General of the Parliamentary League for NTDs.
Good afternoon, everyone. こんにちは。Bonjour. Assalamu alaikum. And Jambo Habari. It is my great pleasure to be here with you and for this important session on neglected tropical disease. Let me begin by expressing my sincere respect and appreciation to all those who made today's event possible, particularly the Institute of Tropical Medicine at Nagasaki University for its long-standing leadership and in infectious disease research, especially in the field of NTDs. I also wish to acknowledge our esteemed co-organizer, the GHIT Fund and DNDi, SDGs Promise Japan, under the Japan Pharmaceutical Manufacturers Association, which is JPMA, and the NTDs Youth Organization. My own political journey began in Africa with tropical infection disease. As a medical student at Nagasaki University, I joined the institutional activities in Africa and elsewhere, and witnessed not only the suffering caused by disease, but also the deep inequality and the poverty behind it. This experience is shaped my conviction that such challenge must be addressed through policy and political leadership. Today, as you know, my country first policies spread globally. The most vulnerable are too often left behind. Ensuring that NTDs are never neglected in the global health agenda is therefore not merely a health priority, but a moral imperatives. Now is the time for Japan, as a long-standing friend of Africa, to face this challenge together and strengthen our support. As Secretary General of the Parliamentary League for NTDs, I have worked to strengthen support for this cause, including backing Japan's pledge to GHIT, Global Health Innovative Technology Fund. I wish to express my deep respect and gratitude to Dr. Osamu Kuni here, CEO of GHIT Fund, for his leadership in advancing innovative partnership to combat NTDs, malaria, and tuberculosis. This March, GHIT's long-term appraisal counter for this March, GHIT's long-term investment achieved a milestone. The pediatrics formulation of appraisal counter for schistosomiasis was administered to children in Uganda and Ivory Coast. It is a powerful demonstration of how Japanese innovation can improve lives in Africa. And my heartfelt congratulations also DNDi. To go to DNDi, the Drug for Neglected Disease Initiative, for receiving the Hideo Noguchi Africa Prize. DNDis have developed 13 accessible treatments for 6 deadly diseases, 9 of them in Africa. including the first oral treatment for Gambians' human African trypanosomiasis, now on the WHO essential medical list. In this work, Japanese pharmaceutical companies have played an indispensable role. This collaboration with DNDi and other product development partnership, PDPs, have helped to translate science into impact. Through R&D, knowledge sharing, and long-term engagement. Furthermore, some companies such as Eisai have gone beyond R&D to provide medicine donations, ensuring that critical treatment reach those in need. These contributions represent Japan's strong commitment to global health, equity, and access. Finally, I'm especially encouraged to see youth voice in today's program. Your passion, creativity, and determination will carry forward to the work, forward the work we begin here, and shape a future where no disease and no person is left behind. I urge you to take up this mission with courage and vision. Thank you very much.
Thank you, Dr. Kunimitsu, for those inspiring words. Now, please allow me to provide a brief overview of today's session. This event builds on the momentum of the G7 Health Ministers meeting held in Nagasaki in May 2023, and especially the Nagasaki Outcome Statement on NTDs. Today, we aim to explore how Japan, Africa, and the global community can translate these principles into action through partnerships and science, local leadership, and the power of youth. Let us now hear from one of Japan's leading voices on innovation and global health. Please welcome our keynote speaker, Dr. Osamu Kuni, CEO of the Global Health Innovative Activity Technology Fund. His talk is titled, Driving Open Innovation to End Neglected Diseases, Japan and Africa in Global Health Society.
Kunimitsu-sensei, thank you very much for your good speech. And distinguished guest, good morning, everyone. So I'd like to talk about driving open innovation to end neglected diseases. So I'm now working in GHIT, the Global Health Innovative Technology Fund. Before that, I have been outside of Japan, almost 20 years, working in the Global Fund and also in Africa through UNICEF and Asia and other countries. I came back here to Japan because I felt I also need to, give back to Japan. Actually, we got a lot of, benefit and really kind of support from Japan, especially through UNICEF, Global Fund, and other NGOs. But actually, I felt a bit kind of a regret during that COVID, because although Japan has really great technology, great experts, professionals, but it was a bit delayed to really kind of develop new tools for COVID and could not contribute a lot to the world, right? Actually, when I was working in a global fund, I found 2 private sectors which could develop that rapid testing for COVID-19 within almost 100 days. Actually, officially, they said that the rapid testing was approved in 280 days. It is the US and Korean kind of rapid testing. But even before that, I know that Japanese technology already could develop. But unfortunately, it could not be contributing to the world. So, the GHIT, I'm now the kind of head of GHIT. This is the organization, Tokyo-based, but a real international public-private partnership created 12 years ago to catalyze partnership between Japanese and global entities and facilitate open innovation and leverage Japanese technology. So as you know, even after the COVID, we still have so much unmet demands in the world through this infectious disease. Malaria still infect more than 200 million people, and TB, tuberculosis, kills almost 1.2 million people. Actually, the average the mortality of COVID is roughly 2 million. So over 1.2 million people dying every year is a really big issue. And as you know, neglected tropical diseases, it is a group of 21 diseases and conditions really infecting or affecting 1.5 billion people. But you know, it takes usually around 10 or more years for developing new tools, especially vaccine and medicine. And also, it costs a lot, sometimes 500 million or even 1,000 million US dollar, 1 billion US dollar for developing. And even after 10 years and spending 1,000 US dollar, 1,000 million US dollar, sometimes it failed in this new tools. That is why there's very little incentive for private sectors to the research and development in these new tools for these kind of neglected diseases. And these neglected tropical diseases, as I said, are very much related to disability, disfiguration, and discrimination. There is like a dengue fever, very acute one, but leishmaniasis, sleeping sickness, Chagas, many are kind of chronic diseases. Gradually that affect and damage variety of organs, sometimes the skins, etc. So the disability, disfiguration, or discrimination really gives a lot of problems to the people. And it's lead to the low productivity and the economic loss. So this is kind of diseases which really push the people into a trap of poverty. Trap of poverty, people in a poor condition getting much poorer and poorer because they have to spend money for this treatment. So sometimes they don't want to have a treatment. Or even in such kind of a poor area, there's no hospitals, clinics, and even medical services. Okay, so GHIT approach to these challenges is developing and promoting the development of drug, vaccines, and diagnostics to fight infectious diseases among the people left behind, malaria, TB, NTD, and emerging diseases. Actually, there are a lot of good international efforts for the pandemic preparedness and response. So there is CEPI and also SCARDA in Japan, and quite a good amount of money. But they are mainly concentrating on the vaccines. But before vaccines, we have to really make a good rapid diagnostics test, right? And I found a lot of good technologies in Japan for this, diagnostics. So nowadays, even Mpox, Mpox is still, it is a pandemic. But not so much kind of communication and not so much awareness, right? So I talked with, some of the companies, and they developed the prototype within 1 month. And even that crude 1 month of, prototype already show that over 70% of sensitivity. It is amazing. So there are such kind of potential technologies in Japan. Okay, so we are investing and good track record. So far, we have invested 350 million US dollar and over 130 projects and working with 180, the partners, and 2/3 of them are outside of Japan. And nowadays, the Japanese government, thanks to Japanese government and the parliament members, really kind of great support. And half of our budget are coming from this government. of Japan, and half of them from private sectors. Especially half of that private sectors are coming from Gates Foundation and the Wellcome Trust, two very prestigious foundation. And the remaining, the quarter, coming from 15 the private sectors, including quite big farmers and diagnostics, and even the farmer outside of Japan. We invest almost 46% in NTDs, neglected tropical diseases. Actually, I found that this allocation to tuberculosis, 9%, is a bit kind of small. I really want to see more, application coming to TB. TB is a bit kind of difficult because quite complicated, that pathology, and very difficult. But there are some good the researchers in academia and also good industries in Japan. So we really want to get more kind of application for that. Okay, so we have a quite good example of this R-praziquantel, already Dr. Kunimitsu already mentioned. So there are kind of medicine, the praziquantel, but it is very big, bitter, good for the adult, but not good for children. Usually because of bitterness and because of the big size, they cannot, take. So even more than 50 million children are suffering from this schistosomiasis. Do you know schistosomiasis? Actually, it was in Japan also. Schistosomiasis japonicum. It is a very big issue. If you have never read that book, Shi no Kai. Shi no Kai is dead, the snail. It is a quite long history of this schistosomiasis, battling that one. It is a very good documentary. You can read it, and you should read it. There are a lot of effort by clinicians and the hospitals in especially Yamanashi prefecture and Fukuoka and several others, because these are very much kind of endemic, not epidemic or pandemic, because a very limited and also kind of the specific area are affected because of the snail. These very specific snails are residing in very specific rivers and lakes, etc. But there are big battles, and once that the children, get soaked in the river, the cercaria came through that the skin and affect. And if the children are infected, especially before the 5 years at the age, they usually within 10 years they died at that time. So it was a very big issue. So it is not very far away from Japan. Even close to your areas, they are affecting a lot of people. So that really great partnership of pharmaceutical companies, especially Merck in Germany and Astellas in Japan, they work together for making a quite small the formulation, and also the Brazilian and the public institution, they made this the manufacture that the drugs for the clinical trials, and hospitals in Cote d'Ivoire and the Kenya, they supported the clinical trials, and of course the GHIT fund and also EU also supported the funding. So this is really kind of a power of partnership. This kind of combination really made this medicine, really in this world. Okay. So we already made quite a good YouTube. Actually, we have a very good brand communicator in my GHIT. So they are producing a lot of YouTube and X and etc. So this short video really show that good history over 12 years of history of this the praziquantel. So please see it. We get really great engagement and support from Japanese government, especially the recent G7 Hiroshima the summit that the then Prime Minister Kishida really kind of pledged $200 million pledge to us. And Kunimitsu Sensei and other parliament members really supported. It is not so easy to get this kind of pledge, right? it's very, very tough because there are a lot of, lot of kind of issues in Japan, and government have to, allocate that money. So even 200 million US dollar pledge is a huge. Actually, that the budget to WHO is roughly now maybe 50 million or 60 million, I guess. But this is 200 million, so quite a big amount of money. So thank you very much for that, this contribution. And at the time, the G7 summit, the Nagasaki outcome statement highlighted this Japan-led initiative to contribute to raise awareness for this very important topic. Actually, there was several kind of declaration in Kigali, in Rwanda, and London, and this is a kind of third one, I believe. So this was quite not only Japanese, but international kind of declaration and the real support to control and eliminate this neglected tropical diseases. So Nagasaki really, contribute a lot. And thank you very much for all the kind of work on this. But this outcome statement is not just only for a statement, but we really have to make a real action. Actually, I myself don't like just conference, talk. Actually, I'm a bit kind of bored of that kind of just discussion. Actually, I was working in New York, UNICEF, and also Geneva for 9 years. But sometimes talk a lot. But sometimes action is a bit delayed. That is why we really need to make real good, this action. And now it's a very important time of this TICAD9 because all the key partners is coming from all the world, from Africa and even from the other countries. So now it's very, very important to make a real kind of action, right? And these include visibility and the multi-sectoral approach and, end-to-end ecosystem, not only just, promoting research and development, but also access and delivery. Innovation is not only just research and development, but also access and delivery. Actually, when I was working in UNICEF, we have products. We have very good medicines, diagnostics, but just reaching out to the people in need in very remote area, it's really difficult. That is why we really needed that some of innovative way of procurement, logistics, and delivery. So innovation also needed for those kind of things. But of course, there are still a lot of new, diagnostics, vaccines, medicines needed in the world. So I really want you to participate in this really important research and development and access and delivery effort. Thank you very much.
Thank you, Dr. Kuni, for setting inspiring words. We now move into a set of spotlight presentations of global scientific collaboration to tackle neglected diseases. First, we welcome Dr. Luis Pizarro, Executive Director of Drugs for Neglected Diseases Initiative. Title of his talk, From Vision to Access, DNDi's Role in Transforming R&D for Neglected Tropical Diseases.
Good morning, good afternoon, konnichiwa, everybody. First of all, dear Ayano Kunimitsu, thank you for your speech. Dear Dr. Kuni, thank you for all your commitment and your effort for being today. Distinguished guests, distinguished friends, colleagues who are here. I would like, first of all, to thank you, the Nagasaki University, for your invitation and your very strong commitment to NTDs. You're working in Africa very hard, but also in Latin America. I know that, and I said yesterday, next time, because I come from Chile, I would like we do that in Spanish and maybe in Latin America. So I count on you for this. And this morning, what I'm going to do is that I'm going to quickly introduce the work we do at DNDi, and I will give the floor to my colleague, Wilfried Mutombo, who will show you the work DNDi has been doing on sleep and sickness, and this is the reason why DNDi has received the Noguchi Prize this week. So let's go to the next one here. Just in a few words, DNDi is a non-for-profit R&D organization that it's working on, we say, neglected diseases, but I think it would be more relevant to say neglected population, because the objective of the work we do is to try to fill this gap of the current R&D system, who is not addressing, unfortunately, the needs of, as Dr. Cooney said before, 1.5 billion people around the world. And it's the fact that those people are neglected that it's really motivating our work. DNDi was founded 20 years ago by different countries like Brazil, like Kenya. I see here my colleague from Cambridge who is there. He's my boss, so I need to be careful. But also people from India, from Malaysia, WHO, of course. And the organization who brought those countries together was MSF, Doctors Without Borders, who just got the Peace Nobel Prize and decided to invest in this very important topic. DNDi has developed in 20 years with all our partners 13 treatments, 1-3. And this is really a very, very important achievement. But this achievement will never be here if we were not collaborating with people, first of all, from all around the world, but also from very different sectors. And I would like here to highlight, you see the current pipeline of products at DNDi, the amazing work we have with Japanese colleagues. You see in Chagas, in leishmaniasis, also in pandemic preparedness, or in parasitic worms, that we are working very, very strongly thanks to the support of GHIT, of course, to the support of the Japanese government and many, many Japanese academic colleagues. Probably one of the best examples of addressing neglected diseases is the one we have done with our colleague from Sudan, Professor Fahal, who is here, that will be explaining just after me the amazing work on mycetoma. But this is also something where an important Japanese company, Eisai, has been strongly committed since the beginning, especially thanks to the support of their CEO, Mr. Naito, who has been pushing and pushing to develop a drug for mycetoma, a very much neglected disease. But Professor Fahal will explain that just after me. So without waiting too much, and I would like to give the floor to my colleague, just really saying a big, big thank you, of course, to the Prime Minister of Japan, the government of Japan, who has given the prize, Noguchi Prize, to DNDi. This is something we are very proud and very honored. But I would like to insist here that this prize, we take it in a very humble way, because we would like that all the NTD community, all of you that are here in the room, especially all the patients, all the health workers, all the ministers of health, in each country we have been developing those drugs. They need to feel that this prize is for them, okay? And we're just sort of ambassadors that are receiving this prize to celebrate the hard work of everybody to make those 13 treatments today a reality. So thank you very much. Very, very deeply thank you to the government of Japan for this amazing prize. And I will give now the floor to Wilfried, that will show you a very nice example of how we have been addressing sleep and sickness. So up to you, Wilfried.
Thank you so much. Next. Please welcome Wilfred Mutombo Kalonji, Head of Clinical Operations and the DRC for DNDi. He will share insights on field-level implementation of clinical trials in Africa, titled Sleeping Sickness, Delivering Breakthrough Treatments for Sustained Elimination.
Thank you very much. First of all, I would like to thank the Japanese government for giving me this opportunity to travel to Japan to attend this kind of meeting, to meet interesting people like you, and to visit this beautiful and special country. Thank you very much to Japanese government and to Japanese people. So I am Wilfried Mutombo. I'm a medical doctor. I'm based in the Democratic Republic of Congo. I work for DNDi as head of clinical operations. So I've been working on sleeping sickness now more than 20 years, a bit. So what is sleeping sickness? So sleeping sickness is called again human African trypanosomiasis, is transmitted by a bit of tsetse fly, and caused by Trypanosoma brucei. So now, what is important to know is about 3 million of people on the world, mostly in Africa, are living in the area of moderate to high risk of transmission of this disease. And more than 60% of cases, reported cases, are reported in my country, the Democratic Republic of Congo, which is the very affected country by this disease. Fortunately, this last year, we note the decrease of number of cases, but we need to keep committed. And we have two strains of this disease. A very current one, a chronic one, caused by Trypanosoma brucei gambiense, the very common and the chronic form of this disease, and a bit rare, an acute form caused by Trypanosoma brucei rhodesiense. And this disease evolves in two stages, and treatment depends to this stage. This was important to know about this disease. And the objective of DNDi, or the goal of WHO, is to stop transmission, zero transmission, by 2030. And DNDi is aligned with this by doing what we know to do. So by doing clinical trial to find safe, effective, and easy to use drug. Easy to use is very, very important, as this disease affects people on remote area. So this slide is just to show you where we come from, where we are now, and what is our expectation and what is our dream. So 15 years ago, the only available drug was melarsoprol, an arsenic-based drug, and that one was very toxic. And you can see one of our patients described it like a fire in the vein. So this injection was very, very painful. And the drug was toxic because sometimes you were losing patients not for disease, but due to the treatment. And that was very, very complicated and disappointing. But this is where we come from. And from 2006 to 2008, DNDi performed a clinical trial on NECT. NECT, it was what we call a repurposing. So it was a combination of nifurtimox oral treatment and eflornithine given by infusion during 7 days. And this trial showed that NECT was effective and safe. And in 2008 and 2009, WHO had NECT as first-line treatment for the treatment of sleeping sickness. That was a great success and an important milestone. But we continue, as I say, it's very important to develop effective, safe, and easy-to-use drug. So in 2018, it's very important but the clinical trial were performed from 2012 to 2016 in the Democratic Republic of Congo and in the Central African Republic. And that was a clinical trial in the first oral treatment for both stages, stage 1 and stage 2 of disease, and it was dexamethasone. And in 2018, European European Agency of Medicine gave a positive opinion, and the drug was registered first in the Democratic Republic of Congo, and now is the first-line treatment in all affected countries for both stage 1 and stage 2. But this is for the acute, the chronic form of disease, so the trypanosoma gambiense. And we continue to perform clinical trial for the rhodesiense form, the acute one, and those trials were performed in Uganda and in Malawi. And last year, 2 years ago, in 2023, AMA gave a positive opinion for fexinidazole for rhodesiense, for rhodesiense form of the disease, and the drug has been registered in Malawi, the first country who registered this drug for the treatment of this acute form of human African trypanosomiasis. And the goal is to develop a breakout single-dose treatment. And we are very advanced with this acoziborole project, and the dossier has been submitted a few days ago at European Agency, and so we keep optimism. We hope that we'll have a good result. But this slide is to show you how it's challenging to perform clinical trial in human African trypanosomiasis, because as you know, or you may know, this disease affects rural community and living in very remote area. But to perform a clinical trial, you need to be GCP compliant, you need to be compliant with all those regulatory aspects, and it's very, very difficult. First, you need to perform that clinical trial in those areas where you have hospital but in very, very bad state, you don't have electricity, you don't have flowing water. Even to reach those areas, it's difficult, and with very, very poor infrastructure. So we had to deal with all this, finding practical but acceptable standard, even international standard. So by training people, by doing rehabilitation, by doing equipment, providing internet, providing solar system, providing all equipment, laboratory, training people, even setting up the safe way to go to those sites. As you know, clinical trial, it's a work of big team. So you have local team, but we have team providing support in Kinshasa, coming from Europe, and you must find the way to bring them in the safe way to those sites, to those remote areas where you don't have airport, or if you have airport, all air companies are blacklisted, and sometimes you need to take sea, and so we have to set up all this to be sure that we are compliant with ethical authority, with regulatory, with GCP. And even another factor, so you are working on poor population and highly treated. So we had to be sure that when they give the informed consent, they give it freely. So we had to set up all kinds of visual support to be sure that we are compliant. So we face all this challenge with the support of all the team, and now success is within reach. So the great success, I think, it will be the elimination of sleeping sickness. So by this last slide, this is one of our former patients, Ismail. This is Hope, and I would like to thank all our partners. They are listed there, and thank you for your attention.
Thank you both for your inspiring words. Now we move to the front lines where innovation meets the community. Please welcome Professor Ahmed Fahar, Director of the Myostoma Research Center, University of Khartoum. His talk is titled, "From the Front Lines, Students Fight Against Myostoma."
Your Excellency, honorable colleagues, ladies and gentlemen, I am very much honored and pleased to be this afternoon with you here at this important session on neglected tropical diseases. Being part of this highly reputable meeting is an honor and a pleasure to be here in this TICAD and to be part of this and to talk about the myostoma. My name is Professor Fahal. I am a professor of surgery at the University of Khartoum, the Myostoma Research Center. First, I would like to declare there is no conflict of interest in this presentation. All photos were taken after a written informed consent. I'm going to talk to you about our journey with the mycetoma as one of the badly neglected tropical disease. Hopefully, in the coming few minutes, I'm going to talk about mycetoma as one of the badly neglected tropical diseases with many socio-economic impact on patients, families, and communities. And I'm going to share with you the challenges we faced in dealing with these patients, and I'm going to take with you some take-home messages at the end of this presentation. Actually, the main objective, it is to share with you some of our challenges we faced in dealing with mycetoma patients and the very few meager opportunities we had in the past, and we hope we have more in the future. And that based on our experience on the Mycetoma Research Center Sudan, which is the only WHO collaborating center on mycetoma and skin NTDs. Ladies and gentlemen, mycetoma, it is one of the badly neglected tropical diseases. It is a chronic disabling disease characterized by the 3 Ds, the disabilities, destruction, and discrimination. It destroyed the life and the body of the affected patients. It destroyed the communities where it is affected, and it destroyed the health system where mycetoma is endemic. It was recognized by WHO in 2016 as a neglected tropical disease after a long battle to be accepted as a member of this family. It is a unique neglected tropical disease, and I will show you in a minute why it is a unique neglected tropical disease. You can see how massive the mycetoma in this patient, affecting the cranial cavity. It can be as shattering as this massive foot mycetoma, difficult to treat and difficult to manage. And you can see in this young chap with actinomycetoma, which is a benign part of the type of the disease, but still he came a bit late due to a lot of causes, ended in amputation. And here you can see how disfiguring is the problem is. And you can compare the normal limb with the abnormal limb at this site. It can be very disabling, very aggressive in this patient with a blown knee mycetoma, ended in amputation, recurrence in the stomach, recurrence in the abdominal cavity, and it start to pass some grains in the urine because it affected the urinary bladder. It is definitely, it is one of the very disfiguring and disabling condition. As you can see in this lady, difficult to execute her normal activities. No doubt, it is disabling, it is disfiguring, and it can lead to a lot of social stigma. It has a typical characteristics. It affects the poorest of the poor in poor remote communities. It enjoys all the other neglected tropical diseases characteristics, no social life, no work, and no education, literacy, and poverty and stigma. And in fact, it is one of the important causes of social stigma in the areas affected. Sadly, about 30% of our patients are children, and can imagine the misery of these patients affected with patient with mycetoma, as this patient has intracranial pressure. Most of the patients are children and students, and you can see the misery and the difficulty this patient can face because he will going to have it for quite a long time, if not for life. 30% are students. That means loss of education. It is a cycle of poverty and ignorance and stigma. Most of these patients are from the low socioeconomic status. They depend for quite a long time on the local traditional treatment. And that will lead to massive complications, late presentation, and hence poor management and outcome of these patients. To address these things, we established the Mycetoma Research Center. At the Mycetoma Center was established in 1991. And at that center, we did a lot of activities. We managed more than 12,000 patients with mycetoma. We conducted the first ever double-blind clinical trial. We are very thankful to ESI and to GHIT for support and the DNDi for supporting the first ever double-blind clinical trial. We are using new diagnostic tests to confirm the diagnosis of mycetoma. We have 3 satellite centers in endemic areas so as we treat the patient locally at their villages to avoid them coming all the way to Khartoum for treatment. And we have SIDE, and this is the vocational training center to care for the patient after treatment. As you know, most of these patients, they develop deformities, destruction, and the complication of surgical intervention and amputation. And this is one of the nice outcome of our patients. This is the patient came all the way to Khartoum for mycetoma treatment. She had a massive mycetoma, actinomycetoma. In a few months' time, she was cured. That is for the bacterial type. But for the eomycetoma, the fungal type, the story, it is miserable and not and gloomy as well. In the area of research and development, we have more than 50 postgraduate students. We publish extensively on mycetoma, different aspects of the disease. We have many projects around the globe with friends, colleagues, support from other institutes. We have the first ever Al Hassan Center for Clinical Trial. This is one of its kind in the area. And then now we are using most activities, we are using AI for execute our activities. As I mentioned, we have more than 23 international bodies working together to execute the vision and the mission of the Mycetoma Research Center. I am glad to say that we are working now for a new point-of-care test with many colleagues, and an important colleague now we are working with is the EMET project in Japan, Nagasaki University, and other 4 renowned universities in Japan as well. So we're hoping that in the coming future, we're going to have a simple test like this to the field, test in 1 to 2 minutes, and then we can have the diagnosis of mycetoma. In the area of community engagement, we have many activities to promote, to advocate, increase the awareness of mycetoma, to improve the quality of the life of the affected patients. This is our satellite center in a village called Unsa, where we see patients, we treat them in the village, and so we reduce the burden of the patient to come all the way to Khartoum for treatment. We are very grateful to ESI company, the DNDi, GHIT for helping us to find a new drug for mycetoma, and we hope to have more future drugs which can be more effective a short duration. We need to have a good diagnostic test for mycetoma. Still, we don't have a point-of-care test for mycetoma, and really we need to have that as soon as possible. And we need to have a very clear plan for prevention and control. Ladies and gentlemen, it is a 10-minute talk. I am going to be very brief, so I would like to give my conclusion by saying that still, mycetoma, it is one of the badly neglected tropical disease. It is a scar on the human conscience, and our job it is to heal it because it is one of the non-glorious diseases. Our patients, they deserve a good treatment, good diagnosis, good prevention measurement, and they need to have a full support nationally and internationally as well. We are very grateful to Nagasaki University for supporting our students. This is one of my students here in Nagasaki. She's having her master's degree, and thank you very much for your kind attention. Thank you very much.
Thank you very much. No conversation is about future is complete without the voice of youth. Please welcome Mr. Yuya Kondo, board member of the NTDs Youth Organization. He will speak on Youth in Action, youth-driven initiatives to shape the NTDs agenda.
Thank you for the introduction. From here, I'll share the youth perspective, introduce how young people are engaging NTDs agenda in Japan. My name is Yuya Kondo, serving as a board member for NTDs Youth Organization, and I really appreciate for this opportunity. And so every time I go on stage like this, the very first question I usually get is this: are you youth? This is a really nice question, because I'm always asking myself, I'm youth, but I want to share one picture. Do you know him? Yeah, he's a really nice baseball player. And how many of you think he is old? Okay, how many of you think he's young? Raise your hand, please. Yeah, that means I am young, because I was born exactly same day with him. So from here, I say I am young, okay. Let's go back to the track. Maybe some of you don't know about our organization, so I will introduce about our organization first. We are a youth-led team of students and young doctors working to raise awareness of NTDs, build partnerships, and help reduce the disease burden. We currently have 24 members right now. When we first started, there were only 3 members, and it's been amazing to grow this size over just first 3 years. Our organization is divided into 4 main departments: advocacy, contest, research, and study tour development. Today, I will go into more detail about first 2, the advocacy and the contest department. Let's start with the advocacy department. We have made several policy proposals regarding NTDs to numerous decision makers, including the Minister of Health, Labor and Welfare, and the State Minister of Finance. You see, Dr. Kunim is here. We were able to gain agreement to work together on NTDs, a group of diseases that is by no means well known in Japan. In addition to our individual policy proposals, we have also focused on building a strong relationship with NTDs parliamentary group. We made sure to highlight the importance of collaborating with the next young generation in their proposal to the minister. Also, we collaborate with a wide range of NTDs champions. This photo was taken when we invited leaders from Pacific nations, such as PNG and Vanuatu. We were able to have very meaningful discussion here in Japan. We've also been working closely with partners worldwide. We met with the WHO NT director and staying close in touch with ESPAN, which works on NTDs across Africa. Every year we join NTD conference, and sometimes we speak as a youth voice to share Japan's efforts. Here we can see many colleagues from Global. We have also strengthened our collaboration with global youth who are engaged in the fight against NTDs. We shared ideas and activities through meetings and webinars. Let's go to the next, contest development. Just like with advocacy, raising awareness of NTDs among Japanese public is equally important. We have targeted young people with strong outreach capabilities and have hosted the NTDs contest twice so far. This contest has provided an excellent opportunity for young people to learn about NTDs and present their ideas and proposals. And I have to, emphasize on this contest is not something just we organize our own. It was made possible thanks to the support of many different sectors here in Japan: GHIT, JAGntd, JPMA, SPJs. And also, we have leadership offshore endorsement from government ministries and agreements. This year, we are hosting the 3rd NTD contest. Applications are set to open on September 1st. And over the next 5 months, we will be ramping up activities toward World NTD Day, which is January 30th. This is new flyers. Maybe this is the first time to show for public. This year, we're not just focusing on the context. We are also launching a new initiative to go directly to junior high and high school to talk about NTDs and global health. You see, right now in Japan, the regular school curriculum doesn't really cover NTDs or even global health in Japan. But even with that, there are so many students who dream of working overseas or dream to work with people from other countries. We want to reach out to them and show them just how interesting the world of global health are. We've already secured 5 schools so far, but we are planning to increase that number this year. Oh, this is the conclusion. And this slide summarizes the results of our activities so far. Through our advocacy efforts and awareness-raising initiatives, we have achieved significant outcomes like this. Specifically, we have collaborated with more than 40 partners worldwide. And we have engaged with more than 50 decision makers. And by appealing in many outlets, we have also contributed to raising awareness of NTDs. And this the contest video have surpassed more than 10,000 views and reached 2,500 people. Finally, I would like to share our future. We are going to keep working towards the control of NTDs, both directly and indirectly. But the most important thing I want to talk about is we are really aiming for beyond that is discovering and nurturing the next generation. We are a youth-led organization, but unfortunately, as individual, youth time is short. That's why we want this organization to be a home for young person in Japan who want to jump into the world of global health. We will provide opportunities for passionate young people and create projects where they can really make a difference. We're going to have some thematic event today from 6 p.m. And this is our first step to start a new project here. So if you have time, please join 6 p.m. at 6:08. Thank you.
Thank you so much for sharing powerful message. We now invite Professor Satoshi Kaneko, Secretary General of JAGntd and faculty at the Institute of Tropical Medicine, Nagasaki University. He will present a short reflection on from the Nagasaki outcome statement to TICAD9, what's next? Sharing outcomes of the G7 Nagasaki event and perspective for future collaboration.
Okay, so good afternoon. So my name is Satoshi Kaneko. I introduced here. So I want to review again Nagasaki outcome statement. Dr. Kuni already mentioned. If you want to know the details, please come to this QR code. All the statements is there. So if you are interested in, please visit this site. Anyway, so I want to review shortly what is the Nagasaki outcome statement. Some of you joined the meeting at the time, but most of you don't know. So Nagasaki outcome statement, what is this? So commemorative side event of the G7 Health Ministers meeting was held and hosted by GHIT Fund and the Nagasaki University and the United Combat NTDs in May 2023 Nagasaki. And the leaders from government, PDPs, product development partners, and academia and the Global Health Organization joined. The Nagasaki outcome statement was the result at the time of the symposium, and also it contained a declaration of principle to guide future global NTD action with endorsements from several organizations like this, and also it consists of 2 parts. One directed to G7 leaders, and the other one is to the global NTD communities. So what is this is a call to action to G7 leaders. First one is the owner commitments. Translate past pledges from London 2012. That's the London Declaration we have. And also after that, Kigali Declaration we have. And into the action. So we want to add some action to the investment. And the second one, prioritize NTD politically. And champion NTDs in G7 Summit, G20 Summit, and the UN General Assembly agendas. And also third one, leverage procurement. unite pooled procurement for NTD technologies. And fourth one, support R&D, research and development models. Fund non-for-profit research and development like PDPs and access strategies. And empower low middle income countries R&D. This is support local research and development, and also South-South collaboration. And the last one, the investment in innovation. And this is a call for community action for global NTD communities. First one is increase visibility, raise awareness of NTDs as a NTD use mentioned. Most of the people in Japan don't know about NTDs. And emphasize socioeconomic impact to drive political will. And the second one, strengthen political leadership, like this. And the third one, innovative financing. Develop a few funding mechanisms to supplement existing flows and create compelling investment cases of our research and development. And the fourth one, targeted resource mobilization. Focus on underfunded and newly listed NTDs and accelerate progress with even small-scale investment. The last one, open collaboration of ecosystem. Promote transparent data and knowledge sharing in research and development and improve coordination across access value chain. And this is Nagasaki what we do. And it is highlighted the importance of youth engagement and inclusive governance, emphasizing the need to include the new voice and the sectors in health innovation. Since Nagasaki, we have seen encouraging developments, GHIT Fund, and the Japanese research initiatives continue to expand support for NTD innovation. And African researchers like Professor Faha are leading transformative work on diseases, and NTD youth, like Mr. Kondo said, movement in Japan beyond is gaining the visibility and the transaction. So, but still we have some challenges like this. Climate changes and conflict are worsening disease burdens, and the financing coordination for NTD is still fragile, and the progress risks are stalling without political momentum. So now, next, I want to go to the next session. This is a panel discussion. I want to invite panelists this year, and we want to discuss about what we are going to do after Nagasaki outcome statement. Please wait a moment. We are going to change the layout here in the stage. So, and I want to invite panelists, maybe other presenters, to the stage. Just a little bit, wait. Okay, thank you very much. So now we are going to start a new session, the panel discussion session, the name of Bridging Science, Policy, and Action. Today's session has taken us from global commitment to local realities, from scientific innovation to youth advocacy. The key question before us now is, how can we move forward together? From Nagasaki outcome statement toward sustainable African-led solution to NTDs. Let's begin reflection from key partners from the represent science, youth, and policy. So first of can I ask Dr. Kuni to mention anything, something is possible? We can start at that. Okay. So Dr. Luis, can we start from you? Okay. So Dr. Pizarro. DND has been at the forefront of delivering treatment for neglected tropical diseases, and most recently honored with the Hideo Noguchi African Prize. Congratulations. Mm-hmm. And in your view, what are the most urgent priorities and opportunities to advance equity access to health innovation for NTDs, and how can countries like Japan enhance their collaboration with African researchers and the producers? Can I have your comments?
Thank you very much, and thank you again for all the Japanese colleagues, of course, and the Japanese government for this prize. let's be very humble. The question you are asking is the 1 billion answer. And I know everybody here is working very hard to do that. So very, very humble comments. First of all, I think we are understanding that anything is possible without the patients first. And the more we are able from the beginning of any research we do to engage and understand what the patients need, it's essential, let's say, to have an efficient drug that will be not only developed by research, but also delivered by the health workers. I remember Wilfried told me that in DRC, you heard sometimes patients saying that drugs that were white were for white people, and for Africa we needed to do black drugs. It's something you heard in Kinshasa. And I was so surprised because I said, this is something any of us will be thinking about, but that really can make a difference once we need to deliver. And so being able to listen what are the needs, the heat, etc., but also what the people want, it's something very important. The second one, I think it's about having local and regional capacities for research and development. We talk a lot about local manufacturing, and this is a very trendy topic, and I guess here during the week everybody will be talking about local manufacturing, but it's impossible to have a sustainable local manufacturing if we don't have strong research done in Africa, in Latin America, in Asia. Here our colleague Kelly Shibale is promoting in South Africa and very, very important initiative on drug development. We're very happy to be discussing with him on that. And I hope that many other initiatives like the one Kelly is developing in South Africa, and of course, for instance, what we have heard in Sudan, will be spreading all around the world. And this is absolutely key. And maybe the last one, because your question was about Japan. So I will be very humble too, not to advise the Japan colleagues, because you know very well what to do, but I would emphasize what is the difference, I guess, from what you do compared to others. And I think you have in Japan a very unique ecosystem that start in the universities. We have been discussing about Nagasaki, but thankfully Japan has many other universities engaged in neglected tropical diseases, and not so many countries have this powerful academic strength you have. You have all the pharma sector. We mentioned Eisai just before, but you have also Shionogi, Takeda, and many others. You have the social society, the youth, we're talking here with you, but many other NGOs are engaged here. And you have the political commitment with many MPs, the government, ministers of health, supporting innovative funds like GHIT and others. So if you look today in the world, how many countries have this rich ecosystem to support the NTD world? I don't see so many that can do what Japan is doing. So I don't want to advise. I would like to acknowledge, recognize the great work Japan is doing on this. Thank you very much.
Thank you very much. Very warm for comments to Japan. Thank you very much. And also, so related to the front line. So actually, Professor Fahal working hard for Sudan, for mycetoma. So Professor Fahal, you're a global leader in the fight against mycetoma. And could you share your reflections on what is still needed at the country and the global level to advance innovation, treatment access, and the recognition for mycetoma and other underfunded NTDs? Do you have any comments? Thank you.
Thank you very much, Professor. First, I would like to say that we started the Mycetoma Center in 1991 with a zero budget, zero experience, and zero infrastructure. However, with good collaboration with local, international research institutes, centers, NGOs, friends and colleagues, we managed to establish a very good center with very comprehensive management of mycetoma patients, from treatment to research, community engagement, and support of the patient after treatment by establishment of what is known as the mycetoma Vocational and Entrepreneurship Center. So international collaboration is important to advance the patient management, research, and community engagement. Still, the mycetoma, it is one of the badly neglected tropical diseases. We need more advocacy, more awareness about the disease, and we need to have more funds for research, for management, for community engagement, and for comprehensive management of the patients, families, and the system in general where mycetoma is endemic. Still, we need to have more potent drugs. We are very grateful to ESI for the support, DNDi for support, and the GHIT for support the first ever double-blind clinical trial. We need more accurate diagnostic tests. Still, there is no point-of-care test for mycetoma. We need to work together. We need to involve the companies, the industry, so as we translate our research into something useful for the management of the mycetoma patient at the end of the day. We need to have more research to know more about the epidemiology of mycetoma. We need to know how the infection is taking place. We need to know how we can manage the gap between the knowledge we are lacking now for mycetoma patients and treatment. Hence, it is a collaborative work. Different institutes, locally, internationally, working together. Industry, academia, and patient care, and this is very important. Thank you very much.
Thank you very much, Professor Paul. So, yes. So we should work more for NTDs in the international communities of NTDs, and also research and development is very necessary. I understand. Maybe Japan will work together with you and our other NTDs. Thank you very much. So next, Mr. Kondo. We are inspired by your remarks earlier. Actually, from the youth perspective, what is needed to ensure your young people are recognized as active partners in NTD response in Japan, Africa, and globally, and what does meaningful youth engagement look like to you? That's a question.
Thank you for the question. In short, to be recognized as active partner, I think the concrete, clear outcome. In short, that's it. But I prepared my notes, so can I read? Because this is really nice, really important question. So I have to read this, and I think, as you said, youth activities often recognized and often get attention easily, in positive way, in negative way. But what I think is, the results and outcome of youth activities is not paid attention enough. So there are so many young people doing for just satisfying themselves. So I want to change the situation, not in Japan, only not in Japan. I want to clear what is the results and what is the outcome of our activities. So as I talked in presentation, in advocacy department and in contest department, we still have concrete KGI and KPIs as indicators. So we still keep on it, and we have to share the results to all the sectors, and that is, I think, important thing for youth people to be recognized as active partner.
Okay, thank you very much. NTDs just started. I think we somehow support the young activities because we are now aging somehow. So maybe we should have some next generations. So that's why we are very expected the activities even from now. Thank you very much, Mr. Konto. Last, and Dr. Kuni. So you helped lead the G7 side event in Nagasaki, and that resulted in the Nagasaki outcome statement. And 1 year on, what progress do you see, and what should be our shared message from TICAD9 to maintain momentum on equity, innovation, and localization? I want to have your comments. Thank you.
Okay, thank you very much. So before responding to that question, am I youth? Am I young?
Yeah, you are still youth.
Great.
Yes, youth.
Great. I
You-
just try
you can
to
join.
make myself look young now, beside him. Okay, actually, my definition of, that the youth is not kind of age, but kind of a state of mind and mindset, having a dream and making effort to achieve that, and also excited, every day to making such kind of effort. So anyway, thank you very much. I'm young. Okay, so responding to your question, 1 year after already actually 2 years, right? After this statement, right? So anyway, these are, you can see that the real kind of drastic environmental change, right? Especially when I attended this year the World Health Assembly and the side events. Actually, we had a lot of discussion about, budget cuts, such kind of a dire situation for global health. So actually, that the environment really changed, especially very bad situation you feel, especially in terms of financing. And that is why we have been kind of approached by a variety of partners. Do you have money? Can you support? So maybe it is good news because we can have a more kind of application. We really need to have a partnership. But of course, we need funding. So Kunimi Sensei will support us. Okay, so but this is not just only a crisis, but also opportunity because we have to be quite serious about how to best use of money and how to accelerate this research and development and how to expedite the process. We are talking about 100 days mission for pandemic preparedness. But for this neglected tropical diseases, still, how many years to develop this, rapid testing and vaccine and medicine? Of course, it takes a lot of time because different type of, the pathogen. Pandemic preparedness, mainly it is a virus, so quite easy to get, especially the genomic one. But we really need to piggyback on that kind of innovation because we could repurpose, some of the medicines and some of the technologies. Actually, recently I visited the DRC for, MPOC things, and we found that some of the Japanese technologies could be utilized for that. And recently, we got application. I don't know it is accepted or not, but that is some of the rapid testing for even mpox within 30 minutes. They said even 10 minutes using PCR testing. Actually, Japan has such kind of a technology, but sometimes they are not bold enough to go out and beyond the border. Actually, Japanese people are very shy, like me. Yeah? So sometimes even there are a lot of opportunities and demands, sometimes not go beyond the border. Actually, during that COVID time, there are such technologies, but actually Japanese technology didn't go beyond. Even though I was waiting in Geneva, that the Global Fund tried to find that the better and the quick and rapid testing for COVID, but Japanese, the companies could not respond to because they felt first, domestic first, Of course, it is important to, fill the gap domestically, but at the same time, you have to think about, that international kind of demand. So I forgot your question, but so 1 year, a lot of change. What, equity, innovation, and the third one is what?
Also, I forgot. Anyway.
It is quite
Anyway,
different, different type of things. So you really have to think what we really need to address. First, equity. Where are the people who are really kind of demand, the suffering? Okay, when I was working in a UNICEF, we really need to look at where are the people, those left behind. Because first, identification and how to get access, right? So Dr. Fahar, he is a really great work, doing great work. So this is a very, very important opportunity for him to find partners. And for those who have some technologies to help him, please meet with him and discuss. This is not the kind of a place just talk a talk. Yeah. As I said, I don't like just talking and discussion. I really need to have action, real action. So he needs a technology. Especially he said that very rapid testing. Maybe some of the people can help him. So please contact him. Okay. So those kind of things important. So how to also accelerate innovation? Maybe Nagasaki University have a lot of good innovation, but need to have a real partnership with industries. So industrial people, please contact that academia people. Okay? So this kind of a strategic partnership is very critical. That is why we are here. Thank you.
Thank you very much. So we are now progressing somehow after the Nagasaki. Anyways, thank you very much. So time's so limited. So I want to ask some comments from Dr. Kunimitsu lastly. Hi, thank you very much.
Yes, thank you so much for the Dr. Kaneko, which is well organized this events, and also thank you for your splendid, excellent the speaker, who gave us all of us to the inspiring and very informative stories. And as a parliament member, and as a gratitude of Nagasaki University, and as a parliament secretary general of the Parliamentary League of NTDs, I strongly recognize the two things. First, we have to, our parliament, our government of Japan promote the policy of NTDs much stronger than much more. And the second, we are facing global, we are facing the my own first, my country first, and it's a kind of the very. I know that many countries face this movement, but we must overcome this my country's first movement. So I'd like to give back this message back to the Prime Minister Ishiba, who will join tomorrow this conference. So, and again, thank you so much for the Dr. Kaneko Sensei, Nagasaki University, and all the candidates and the speakers. And again, that we are strengthening much more. Thank you.
Thank you very much, Dr. Kuni. You have to read now. Okay, thank you very much. So we have a few minutes now. I want to open the floor. Anybody want to say something? And oh, you want to do? Okay, shortly, please, within 1 minute, please give us your comments and questions.
Thank you very much. I'm from a startup called Sora. We have AI and drone technology to identify where mosquito babies are coming from in the water. I have a question to Kunimitsu Sensei. From perspective of the shift aid to investment, what role do you expect as some young companies, like startups like us, to play in Africa and public health context? Thank you.
Thank you so much for giving me a question. And I'd like to say, please moving forward to Africa, because as you know, in Japan, as I mentioned, the many people have a big opinion about NTDs and how we moving together with African countries. And your work is excellent, I believe. And please join our team and move forward together. Thank you.
Thank you very much. So I want to have more questions, comments, but time's so limited. So I want to close this session now, panelists. Thank you very much for panelists. So we are going to move to the close remarks. Thank you very much, panelists. Thank you very much. Thank you very much.
Thank you very much, Professor Kaneko and all panelists. To close our session, we are honored to welcome Dr. Sachiko Nakagawa, Standing Director of the Japan Pharmaceutical Manufacturers Association.
Ladies and gentlemen, thank you very much for dedicating your time and energy to today's session. As As this international session concludes, we would like to express our sincere gratitude to Nagasaki University and all those involved. My name is Sachiko Nakagawa from JPMA as a managing director, and I've been in charge of international affairs since April 2020. This is the third time I've spoken about the contributions of Japanese pharmaceutical companies to the fight against NTDs at the international conference. In particular, at the side event of the G7 Health Ministers meeting in Nagasaki 2023, and World Health Assembly, WHA, in Geneva this May in this year, and today TICAD at TICAD in Yokohama. There is a Japanese proverb that says the third the charm. The third time's the charm. I would be very honored if our contributions were understood in this third attempt. To wrap up today's session, this policy perspective presented by Representative the Honorable Ayano Kunimitsu, and the importance of public health, public-private partnership highlighted by Dr. Osamu Kuni, the practical approach of Professor Luis Pizarro and Dr. Wilfred Mutombo, the field-based research of Professor Ahmad Fahal, and the power of youth participation and education introduced by Mr. Yuya Kondo were all discussed, bringing to the light the diverse elements necessary for overcoming NTDs. We would like to express our gratitude to Professor Satoshi Kaneko for organizing and leading such a meeting. And we are making a steady progress toward the realization of the Nagasaki outcomes statement, which calls for accelerated R&D access and delivery for NTDs. It is important to understand that simply supplying medicines is not enough to overcome NTDs. Research and development that is rooted in local needs and sustainable access and human resource development are also necessary. I have emphasized that the importance of necessity of collaborating with a diverse stakeholder base, including those who spoke today. Despite the various risks and challenges faced, it is deeply impressive that such steady progress is being made towards the goal of ensuring that everyone is able to access good health and in an equitable manner. Furthermore, I believe that pharmaceutical industries like ours should be involved in this initiative. JPMA is an association representing research-oriented Japanese pharmaceutical companies engaged in the creation and research and development of pharmaceutical products with the aim of contributing to the health of patients around the world, and considers contributing to global health to be an important mission. As mentioned in today's presentation, we are working on placental pediatric medicine for schistosomiasis by Astras, hosflavuconazole for mycetoma by Eisai, as well as coabdepistat for tuberculosis by Otsuka, and freeze-dried smallpox vaccine prepared in cell culture LC16 for Mpox by KM Biologics. We will continue to work with our partners in Africa to combat infectious diseases, including NTDs. It is important to note that further progress in this field will be driven by the passion and creativity of young people. Finally, JPMA, in collaboration with our member companies, will leverage the outcome of today's meeting to enhance its future initiatives with the goal of contributing to a more promising future. By the way, the Expo 2025 is being held in Osaka, Japan right now. I hope that your stay in Japan will be as memorable as this session. Thank you again for your engagement and support. We look forward to working together to build a healthier and more equitable future for all. Thank you for your attention.
Thank you so much. And then thank you so much again for joining this session. Let us continue working together with Africa to end NTDs and ensure no one is left behind. Thank you so much and enjoy the rest of TICAD9. Thank you very much.